Hello, it's Dr. Jim, and I have some very important information. Maybe you haven't thought about these things for a while, but as we're aging, there are going to be some age related conditions that we should focus on. And I've been doing some research on the top 20 most common health concerns as we age. Why is this important? Well, number one, we're living longer. I just found a brand new statistic, and it's it's great. It's a very positive statistic. On average, in the United States, after you turn 65, you have an average of 19 years more to go. That's an average. You turn 65, you're going to live, and hopefully pretty well, for at least another 19 years, 2 decades. That's great. And you know what? You could be retired and secure and be a grandparent and do some traveling and do whatever you want to do. But you have to pay attention to your health. And you have to focus. If any of these resonate with you, if you're diagnosed with any of these, you know you really have to pay attention to your health. Listen to your doctor, listen to the specialist, take your medications, exercise, eat right, sleep well, reduce your stress, take care of yourself, okay? These are the big ones. Arthritis. We know arthritis is the number one most chronic, long-lasting, age-related disorder on the planet Earth, period. Arthritis is to be human. To be human is to develop arthritis. But we can exercise our bodies, we can become more flexible, we can do warm water exercises, we can use supplements, so many things that we could do. My theme is here at the top 20, age related. We can manage these things. We can manage these symptoms. Okay. Number two, heart disease. This has been one of the leading causes of death for decades, and unfortunately, it continues. It's a chronic condition, and it's related to so many risk factors like high blood pressure and high cholesterol. Again, lifestyle, a little bit of exercise. Watch what you eat. You know, red meat is something that we should eat maybe once a week, maybe once every 2 weeks. We should treat it like a holiday dinner, and we should get more raw foods. I know people are always like fruits and vegetables, fruits and vegetables. Get the raw foods into your diet that feed your gut. Your gut is connected directly to your brain. And all of those little gut buddies are communicating with your brain cells and your neurotransmitters. What's good for your brain is good for your heart. What's good for your heart is healthy for your brain. So, take care of your heart. Third, cancer. Cancer remains the second leading cause of death among people 65 years of age and older. Currently, more men develop cancer than do women. Fortunately, it can be treated with early detection through screenings, which we should be getting. Mammograms, skin checks. If you see something odd that's developing on your skin, go to your doctor. And those dreaded colonoscopies. But you got to do it. You got to do what you got to do, right? The next condition, nutritional problems. As we age, our bodies simply don't absorb those vitamins and those nutrients and the micronutrients like they used to when we were younger. Many people as we age are going to lack vitamins B12 specifically, B6, calcium, and vitamin D. Take your vitamins, all natural ones, not synthetic. Oral health is a concern as we age. Some nutritional problems are directly related to this because we're not taking care of our teeth. So we have missing teeth, we have dentures, we have dry mouth, cavities, so on and so forth. Healthy teeth and gums are extremely important as we age. Not only for eating and enjoying food and nutritional purposes, but there's so much research out there. Please look this up. That neurodegenerative disorders, many of them, start in our mouth and our gut. Sleep problems. Now, sleep problems are not directly related to aging. There's no direct correlation. It's more associated with the medications that we're taking later in life. So, sleep patterns can also change because if you're not active during the daytime, what are you doing? You're snoozing, you're sleeping, and then when it's time to go to bed, you're wide awake. So, we have to be active, some activity during the day. Wear yourself out a little bit before it's time to go to bed. And really understand the side effects of your medications. Next, memory loss. This is perhaps one of the most dreaded things. Nobody wants to lose their memory because we know it's associated with some form of dementia or Alzheimer's disease or something along those lines. So, while some memory loss is quite normal as we age, it's not normal to be unable to name our close friends and our family members. It's not normal to forget what we had for breakfast this morning or the event that we went to yesterday. And then we have Alzheimer's disease. Alzheimer's has been called by some experts the most important disease of the 21st century because we're growing older, we're getting older, we're living longer, and with every passing year, we run a higher risk for developing this dreaded, long goodbye neurodegenerative condition. So we have to pay attention to our memory. We have to do things that are important for our brain. Remain stimulated. Learn new things. Don't repeat what you've already learned. The trick with providing healthy activities to your brain is learn something new that you've never learned before. If you've never picked up a guitar, learn it. If you've never learned Spanish or French, give it a shot. Do a new hobby, do something new. Respiratory diseases. Yeah, we know that these can be very deadly, right? And cause a lot of havoc around our country and around the world. COPD and chronic lower respiratory diseases combined are the third leading cause of death among people 65 years and older. Many older adults also struggle with asthma, emphysema, and chronic bronchitis. They can all affect our quality of life and our daily activities. And they can also cause very severe health consequences. Good old-fashioned flu and pneumonia. What about those? As we age, our immune system just isn't what it used to be. It doesn't protect us so well from germs, bacteria, and viruses like when we were younger. Unfortunately, seniors make up the bulk of those who die or who are hospitalized for pneumonia and flu-like symptoms. So, protect yourself, take every precaution available, listen to your doctor. The minute you start having symptoms and you're aware that something is wrong, seek help. Okay? Osteoporosis. According to the National Osteoporosis Foundation, there are more than 54 million Americans over the age of 50 who have low bone mass or osteoporosis. So what? This is important because it makes the risk of falling, experiencing a bone break, or a fracture much higher. And we don't heal as quickly as we used to when we were younger. And sometimes being hospitalized for a broken bone and not moving around can lead to pneumonia or other health complications. So it can lead to decreased mobility, disability, and really impair our quality of life. Falls, age-related issue that we have to pay attention to. Falls are dreaded by many seniors who have already had a very serious injury, and guess what? They develop, it's not really a disorder, it's just, I would call it a syndrome or an experience. It's called fear of falling. You have one bad fall, you experience an injury, mild, moderate, or severe, and then you develop this fear. So what happens when I develop a fear is I don't get up. I don't get out of my chair. I don't walk as much as I used to. I fell outside. It was embarrassing. I don't want to do that again. So, having a bad fall can lead to the fear of falling, which can lead to a decrease in activity, which can lead to a whole host of other health complications. Diabetes. This is a big one. According to the CDC, 25% of people 65 and older have diabetes, and almost 50% qualify as pre-diabetic. This is another thing that you have to catch early, because when you catch it early, you treat it earlier and you could jump ahead of it. Either condition can cause serious complications with advanced age, either diabetes or being pre-diabetic. Fortunately, a simple blood test, that's all it takes, can identify the problem, and the earlier it's diagnosed, the better. Weight gain and obesity. Weight gain and obesity are risk factors for a whole bunch of other serious health conditions like heart disease, diabetes, and cancer. The higher the weight, the greater the risk. That's all you have to think in your head. Maintaining a good, healthy weight is probably one of the most important things that you could do as you age. You know, getting a little pudgy here, a few pounds there, that's one thing. You know, a dramatically increased BMI, being obese, or severe obesity is not healthy. Roughly 36% of men and 41% of women between the ages of 65 and 74 in the United States are obese. That's too high. Substance abuse. Now, when I say substance abuse, we might think of, being younger, teens in our 20s and 30s and so on and so forth, and experimenting with drugs or weed or alcohol or whatever the case is. But we now know that older adults have substance abuse, misuse problems. Alcohol, tobacco, drugs. Mix all that together with prescription medications and over-the-counter remedies. Now we have a formula for disaster. Okay? Alcohol tolerance changes are age-related. And what that means is you just can't drink like you used to. So back in the day, you could have 3 or 4 beers or 3 or 4 glasses of wine or whatever you used to drink, and you had a higher tolerance when you were younger, 20s, 30s, 40s, even in your 50s. But as we continue to age, our tolerance changes, and we can become intoxicated on just 1 or 2 drinks. So we have to be very careful about that. Depression. There's no other time in life than the later ages where we have so many losses. Loss of a loved one, loss of a spouse, loss of independence. I'm losing my house. I can't drive anymore. I'm moving into a skilled nursing home. Independence, getting around, going to the store. All those things are lost. So depression is natural. So if you feel that you're dealing with heavy losses in your life, it's important to reach out to talk to somebody. Start with your family physician. Start with a spiritual leader or someone you trust in the community, and then go from there. But always seek help. And always remember this: depression is one of the most treatable conditions that we're aware of. But you have to admit it, you have to seek help, and start treatment. Next, poverty. This is a terrible one because a sizable percentage of the elderly population lives at or below the poverty level, roughly 45%. And that just, as a gerontologist, as a human being, as a person, that breaks my heart. Many are single, they live alone, they have few resources. They're also, unfortunately, at a higher risk for poor nutrition, declining health, falls, injuries, depression, lack of medical care and treatment, and an earlier death. So we should be reaching out to those types of people in the community. We have the resources to help them. We just have to find who these people are. Here's an issue. Sometimes seniors don't seek help. We have to be the ones who make the first move. Shingles. This is one that I dread. My mom had it. It was terrible. It looked terrible. It was painful. It lasted for weeks. When we're young, we might develop chicken pox. And then when we're older, we run a risk of developing shingles. According to the National Institutes of Health, 1 out of 3 people 60 years of age and older are going to develop shingles. 50% will experience it to some degree, but by the time they reach their 80th birthday, their risk is higher. A vaccine is available, we know it, so experts agree that it can be effective in reducing the risk of shingles. So get your vaccine if that's what you believe in. So there are the 20 common health concerns to think about, to focus on, and try to prevent as we age. I'm Dr. Jim Collins. Thank you for your time, and I hope you keep coming back for more. Visit my websites, collinslearning.com, ceu.academy, drjimcollins.com, and feel free to email me anytime, jim@collinslearning.com. Thank you.